So I am originally from Clark Summit, which is a suburb outside of Scranton, Pennsylvania, for those folks that don't know that. And I did all of my education for the most part, really, within the Scranton Wilkes-Barre area. So I was born and raised there. I did my undergraduate education at Wilkes University. I did my medical education at Geisinger Commonwealth, right in Scranton, and I did my residency training right here at Guthrie at Robert Packer. So I've lived in this area and been with Guthrie for 5 years now. I guess it would be going on my sixth year. It's like residency basically brought me here. I originally did live in Towanda, and then I moved a little bit closer to Robert Packer during my residency, and then I ended up just staying in that area for the sake of being close to a couple of different things and making it easier so that I can raise my kids there as well. So when I originally was interviewing for residencies, I mean, I chose family medicine just in general as an all-encompassing approach to medicine. There's really not a single person that you can't see. And what drew me to Guthrie was that it really did kind of hone in on that approach when it came to doing my training. Like, we really did see quite a bit from birth all the way to as we age and get older. So being at least, exposed to all different kinds of medicine from that perspective, definitely kind of solidified a nice, like be a nice place to go to do my training. And then when it came time to determine where I wanted to go after this, Guthrie approached me, and of course I was thinking about them as well, but Guthrie approached me to see if I wanted to stay within the area and be, within a practice in Towanda, which is where I am now. So I got talking with them. I met some of the people in the office, and everybody was very great, very approachable. My free time, definitely with my kids, definitely, just playing with them and trying to, I mean, now that the weather's nice, we try to go to as many parks as we can. If it's just my wife and I, we definitely go up to the Finger Lakes, we go to Corning. And sometimes we do fairly regularly, we hightail it back home, spend weekends either with her parents, my parents, the rest of the family, kind of catching up with people there. I do have a lot of friends within Guthrie, so it's something that, we try to get together with them on a regular basis and kind of just check in on each other, see how everybody's doing. If there's one thing that I would want to have patients know about me, that I will always have their back. Whether it might seem like it or not. I mean, it's something that I enjoy talking with my patients, which I sometimes feel can be a lost art, and thankfully it is making a comeback now, where we're being a little bit more open with our patients and trying to see like where they get certain ideas from or how they want to approach their health. And whatever they decide to do, my job is to at least educate them to make sure that I can get them on share their goals and get them on a good path. And in the end, I always tell them, even if it doesn't seem like it in the end, if they're worried about something, I always have their back. Because as a family medicine physician, yeah, I'm a physician, but I'm also an advocate. So anytime, and I've told patients this multiple times, is that, if you ever need an advocate, know that I'm always there for them. And if it's something that they need assistance with, I'm always willing to at least get them in the direction that they want to go in.